Hello and welcome to another live at UK Bright Education. Hi guys, I hope you're well. Today I have two very special guests, all about global health. You guys are always telling me, Ma, I want to do MPH. Ma, I want to do public health. Global health, public health, bit of a confusion. Let's find out what is the truth. I'd like to introduce you to my guests. We have Majek, who's come all the way from Nigeria. Hi, Majek.
Hi, hello.
Hello, and we have Jibran, who is our head of department in life and health sciences and pharmacy at Temitope University. Hi, Jibran.
Hello, Afsana.
Hello. Right, Majik, if you'd like just to introduce yourself, something that, just if you could introduce yourself, that'd be great.
My name is Majek and I'm from Nigeria. I grew up in a city called Abuja, but I'm from Kogi State
Yay! Yay!
originally. Yeah, so I started my pre-master's program in April in DMU, and it's been exciting so far. So yeah, that's it. That's about it.
Brilliant. Right, Jibran, if you could kindly introduce yourself, that'd be great.
Of course, thank you for the introduction as well, Afsana. So my name is Jibran. I lead the DMUIC Health, Life Sciences and Pharmacy department, as well as leading the IAM Global Health linked course, as well as teaching on our sustainability and social sciences module, which of course Magic has seen some of in the past. So yeah, I'm born and bred in the UK, background in health, life sciences, specifically chemistry, and I'm just working to help all of our international students reach their goals and career aspirations in the field.
Sounds like a good plan. So, Magic, if you could kindly tell me, you've come all the way from Nigeria, and you are, I believe, you are the second cohort. Jibran, please correct me. I believe he's the second cohort
First cohort.
First. My goodness, why pre-masters? Why pre-masters linked to MSc in Global Health? Magic.
First of all, I'll start by saying I have a degree in microbiology. So after my degree in microbiology, I did a little bit of work in the clinic and so forth. But when I wanted to plan my masters, coming here for my masters, like I saw going through the school website, and I actually came here through an agent, and he told me, you could go through this course because it's a very good course, and it's new, but you might find it exciting and all. I was like, okay, and I checked about it, and I saw that I didn't really understand it at the beginning because it's
Oh wow.
something very new. Yeah,
Okay.
because I don't know. I stand corrected. I think in Africa, at
Yeah.
large, I don't think there's like a global health and the syllable of education. So it was really, really something new, and and I like trying something new. I like going on new adventure. So I was like, okay, fine. Let me just see what it's all about, and I will see where that goes. So pre-masters, I did the pre-masters because I know I don't have like a foundation on this
Right.
course. It's very new, and I don't want to just jump into the masters because I know from everyone for a fact masters is intense for every course. Doesn't really matter what course you want to do. And I was like, okay, the pre-masters route will be fine. And again, there are so many difference in the study way, like how you submit assignments, how you write up a project, how you write up a research. It was quite different. So yeah, that made me to say, okay, I think I'll take the pre-masters route to help me, to guide me, and to, at least to give me a foundation of what I'm about to dive into for the MSc course. So that's
Brilliant.
why I went through that.
Brilliant, brilliant. So that's your reasons for studying the pre-masters.
Yeah.
Jibran, if you kindly tell us what kind of students or caliber of students are you looking for to study the pre-masters leading to the master?
So essentially, we're looking for students that have got some kind of healthcare related background, because global health sort of expounds some of these ideas related to the health field, medical field, even some of the social sciences. So you'll see some of our admissions criteria when it looks at background qualifications we look at for students: allied sciences, health sciences, social sciences, and of course psychology in some instances. So students who have an underlying foundation concept and idea of the health sciences field, these are the types of students that will be well suited to this kind of program, because they'll have a baseline understanding of what healthcare is, what is health, what is equality, what is equity, and these are the ideas we build on in the program. So having that base knowledge, like Magic coming in with microbiology, he understood things like bacteria, viruses, healthcare, and aseptic techniques to the extent how it's important to be sterile under certain circumstances in the community, in the lab, etc. So he understood these things, and having that background, students appreciate further how does non-sterile environments sort of bring about problems when it comes to diseases and epidemics and endemics and these things. And these are the ideas we kind of build on. So having that good, strong background in the sciences is really essential for a student to really grasp the most out of this course.
Right. Is it true, Jibran, that third class graduates and HND holders, they can actually apply for the pre-masters as long as they've done it in the last 7 years? Is that correct?
I will need to double check that. But I think in some cases HND is accepted, but I just need to check the 7 years.
Okay. It depends. Yeah, it's country specific. Ladies and gentlemen, if you have any doubts with regards to the admission requirement, all you need to do is to DM us direct, and we'll be more than happy to answer your questions. So that's for West Africa, 7 years, but it depends on which country you're at. Well, we have a comment already, so let's find out. We have Aziz Mustafa. Has passion to be in the helpline. Is it possible? Okay, that's a question for Jibran, I believe.
In that case, it would be very difficult, I think, for the student to engage with the content of the course when they have no background in sciences or even anything related to healthcare. So that would probably be a no in terms of admitting onto the course.
Okay. Right. So Aziz, you can DM me direct, and if there's any other courses that we would think that will match with your qualification, we'll be more than happy to help you. But thank you for your question. Brilliant. Okay, that's direct. Okay, so that's basically in terms of why you applied for the pre-masters. What's your ambition? What's your goal in life after graduation, Magic? What's your plan?
First of all, I came here for an exposure. Like I need to gain as much exposure as I need, because limiting myself like in West Africa, or rather in Nigeria, like has so many limitations attached to it, which I couldn't just see myself going forward with what I really want to do. And here, like I think this course really helps me to like part away to what I really need. Because if we look at the health line in my country so far, like this course is talking about many policies in health, how you could gain, how you could good health and well-being is acquired. So looking at it, I'm like, oh, okay, I think this is gonna be a good step, like in making sure I come in through the health line and making sure I do something to up the health standards of my people back in Nigeria, to go back and do as much change that is needed, which I have gained exposure, the teachings and so many things from here. So yeah, going forward in life, I think I'm just gonna go into the health sector, probably just be like a health advisor or something. Yeah. So I think UK is giving me the exposure, and DMU it's a really good backing because they have so many communities in the school that can help you accomplish that. So yeah.
That's right. You're absolutely right. Jibran, is there? So that's what Magic would like to do. Is there any other careers that students can actually go into after graduation? What would you advise?
Yeah, absolutely. I mean, it rounds the students' understanding of global health. So it's quite broad in terms of where they can go into. So essentially, whatever is linked to healthcare, health promotion, health policy, the doors are open for something like that. So just to give you an example of a couple, when it comes to the government's writing up new health policies and new health interventions for things that may have occurred recently, this is what someone can go into. So for example, when the guidance came out about social distancing guidelines during COVID-19, that was a healthcare policy that came into effect. And it's someone who's probably come through the global health field that's helping in these policy writings, okay? So, at the same time, it can be linked to doing some communal work, so some community health promotion. So in certain countries, if you think about Asia, for example, Pakistan, India, Bangladesh, there are certain topics in the healthcare field that are quite taboo. Women's period health, for example, and they're not spoken about. So, global health, they can be outreach in communities and educators to educate the community about these issues, about issues that students talk about issues that young people face, but are a bit maybe shy to speak to maybe their parents or someone else about it. So it's outreach and promoting these kinds of health related issues and health areas. Okay, there's campaigning for certain diseases. Certain areas there's a high prevalence of malaria, so it's making awareness and raising awareness about these issues. Of course, we've got a problem with water sanitation in a variety of different countries across the world. So again, it's promoting awareness about water sanitation, what the problem is. And quite often, one of the biggest issues is a lack of education for a lot of these issues. The people want to do something about it, but they don't know the best way to go about it. So it's someone who's come from global health. They'll go out there, set up a community center or some kind of an education institute to educate those people who live in the rural areas, in the smaller villages, and say, look, actually, you should be doing this with your water to ensure you don't have diseases, you don't transmit diseases, you don't get unwell. So it's quite broad, and it covers a range of different areas that you can go into as a future, which is why it's such a unique course. It opens the doors into a variety of different career paths.
Brilliant. So basically, can I cautiously say that international graduates, they can actually get jobs, let's say in health promotion, let's say in sexual health, or it could be even related to diabetes, prevention of diabetes, let's say working with NHS maybe?
Potentially, absolutely. If you see a lot of the people who are now working in sort of health promotion, their background is often public health, and they've done things like MScs in public health. And I think global health is much more rounded, because public health might be restricted to one locality, one country, whereas global health, it actually looks at health policy, healthcare systems, and the differences between them in different locations. So how is water viewed in the UK in terms of sanitation and cleanliness versus how is it viewed in an African country? Where are the priorities? Why is it that one country is lacking in water sanitation, the other one's excelling? What are the reasons behind it, and how does this impact policy when it comes to changing those things? So there's a lot they can go into, and absolutely one of those, health promotion, is certainly one.
Oh, brilliant. So, Majek, it looks like you can be a very valuable member of society when you graduate. We need more graduates like you to help the world to become
Yeah, we need more people as well. Yeah.
Definitely. It sounds like you can be very valuable even before you graduate. That's great. Okay, so moving on. Do you think, I mean, you're an international student, we've already mentioned that you are. Do you think the pre-masters is actually suitable? Because a lot of because I deal with a lot of West African students, they say, Ma, do I really have to do pre-masters? I really need to find out from you. Was it really worth it?
Yeah, I would say 100% worth it. It was
Oh,
really
wow.
worth it. Yeah,
Okay.
because like I said earlier, like I don't think there's like a curriculum or like in the school system. Sorry,
Is
in the school system where like it says like global health, like you really have to do global health. But once you come here, you look at it, and with the teachers and all, you see that you could really make a really big impact here. Because actually coming here, you could just be like, all right, I might just change like a career path or a course pathway, but still related in health if it doesn't suit me. But I guarantee 100%. I mean, it's going to really interest you, knowing you could start a change, you could make a change in your small community, especially from West Africa, where we're coming from. Like, it's a developing country as well, and there's so many things to take into consideration as to why is this working here and why is this failing here. And like Jibran said earlier, look at the policies and so many things. And just by doing that, just because no one has the knowledge, or let me not say no one has the knowledge, but no one has the experience, no one knows how to go about this, but they just know they want to make a change in their community. Global health is really gonna help you, put you on the pathway. Like, yeah, this, you could do this and make the change. So yeah, I think starting it at first, like in DMUIC, it really helped me a lot to like give me like a straightforward path to know what I want.
brilliant. Brilliant. Right. Cheeky question. Majek, I'm sure Jibran will confirm. Did he manage to squeeze in a summer holiday? Because he started in April and then you did your master's in September. Did he manage to get a summer holiday?
I did. Yeah, I mean, we got like 2 weeks. Yeah, but 2 weeks with assessment. So, but yeah, at the same time, like I said, the course is
It's full
intense.
on.
You
It's
should know
full
you're
on.
coming.
April to September is a full on.
Yeah,
Is it,
yeah,
Jibran?
yeah.
It is. There is a term break they have between the two terms that they take,
Yeah.
which is a couple of weeks. Yeah.
Yeah,
So
they
they do
do.
get a couple of weeks, but it is pretty full on. But saying that, April intake is one of our intakes. Of course, the other one is January, which
Yeah.
would allow students a much longer summer
Right.
break in that
Yes.
period.
Yeah, that's true. Okay, so it depends on the intake. So if you come in January, you'll have a longer summer break. In April, it's not as long. So it depends when you want to come. So ladies and gentlemen, it is a bit late for January, as you can see. It's next month. But if you'd like an admission for April, we are ready to take on your applications, not a problem. Jibran, so Majik was just saying how valuable the pre-masters is. Do you actually start drip feeding global health related issues in the pre-masters so students are not in shock?
Absolutely, absolutely, and I think Magic will confirm this with some of the stuff we did through our modules. It's getting students not only acclimatized to UK education system, because that's one of the biggest shocks, right? They're coming from countries where they're probably not familiar with a lot of things. We'll assess them in a variety of different ways that they've never been assessed before. I had Magic doing podcasts for me in my module.
Oh, really?
Yeah. They had to record and do a podcast on global health issues. And this is something that's probably not seen as a normal way of assessment in your sort of, other countries, non-Western countries. So not only is it drip feeding some of this content throughout, but it's acclimatizing them to the stringent and different types of assessments that they're going to start seeing over their master's programs as well. So there's sort of a two-pronged thing to this. One is getting the content through to them very slowly. That's not just the subject-specific stuff. They do a lot of preparation on research methods, research methodologies, because in their masters, of course, they've got to do a dissertation module. And if they don't know how to carry out research, how to do different methods of research, how to collect data, how to evaluate data, how to present data, doing a master's dissertation becomes very difficult. And an international student going straight into a master's program without any knowledge about epistemology and all this kind of stuff, they're going to be drowning. It is really high level stuff that we want to get into them. And Magic, have you ever heard the word epistemology before doing this course?
No, I haven't.
Yes.
Do you mean epidemiology?
No.
What is it? What did you say?
Epistemology.
Epistemology. No, I haven't heard that word.
Yes, it's something from research methodologies that they have to study. Yes. Okay. Yeah, so it's not science specific. So, an international student, if they were thrown right into a master's program without knowing what this word means, what it involves, how to do it properly, they would find it very difficult. However, Magic, going through the IIM, he's gone through this. He knows what mixed methods research is. He knows what research methodologies are. Right? He knows the types of research. And now he's in the master's program and he hears these words and he's like, actually, I did this at DMUIC. I know what this means. I know what they want me to do. And, I was speaking to Magic a couple of weeks ago and he's saying, look, some of the stuff we're doing in our global health modules is the stuff that you went through. I think you were talking to me about the water sanitation thing, the Mongolia issue, and these types of things, right? Yeah. So this course is such a good preparation for international students for their masters. Even if they believe they're at the level, there are going to be gaps in their knowledge inevitably. And this is going to serve as such a strong platform and a strong springboard for them into the MSc that it's going to set them up for good success.
My goodness. I need to clip this and post this separately. Right, he's lagging. Oh, I think his voice will come up. Right, I just want to say, I believe Magic's dad might be watching. So if you're watching, Dad, please feel reassured. It's a good investment of money. So, Magic, I just wanted to ask you, do you feel, we don't need to tell everybody, it's a secret between you and us. Do you think you're doing well compared to other international students because you prepared with a pre-master? How do you feel in terms of confidence? Just be honest.
Oh yeah, like it really boosted my morale, and we just had one assessment marks, and we just got the marks yesterday, and I could say for a fact, not just for a video, like I did really good compared to how I really thought it would be, because like the marking scheme is obviously different from DMUIC, and coming here it was pretty intense. Like we had so many things to do, watch out for so many keywords and so many things. So I was like really impressed with the mark I got. It was really surprising. So like I said, the DMUIC approach, like it's a really good.
Oh, Jibran, how do you feel?
Fantastic. I'm just very pleased that we've set up our students for success going forward. So I'm glad we were able to support and help them through. And really make them strong contenders for their MSc.
Brilliant, brilliant. So a massive question for you. As you know, everyone likes to jump out into London, but what was it special about De Montfort University? Why DMU, Magic?
Okay. First, I would start by saying I had a couple of schools from my agent to pick
Yeah,
from,
yeah.
and I wasn't really interested in London because it's crowdy and really, and I'm more like introverted. I like just being inside in a quiet space.
Okay.
And once I checked Leicester and I got to see Dumont, I saw University of Leicester and I was like, I didn't know what to think about it. But looking at the Montfort University, I mean, I looked at the start, the teaching academic excellence, they just achieved gold a couple of years ago. So, like, they had so many stats compared to the University of Leicester. They had so many communities that you could join in for international students to make you comfortable as well. And the school is not so far from the city center, so it's really accessible. Like the school is to the train station to the city center, it's like based in the middle of the city, so like it's good for me, and it's quiet. I don't know if anyone wants quiet, the Montfort is leave it
It's
that.
not too quiet. Don't say that. Let's just
Yeah.
Jibran, come on, you have to back me up here. We're not that quiet. Okay,
No,
listen. What about food? Did you manage to get African food? Because there's lots of places on Narrow Road, yeah? Please tell
yeah, I did, yeah, but that was like after a while. I did, yeah. So like the food coming here, the food is going to be a
yeah,
shock for you because if you like spices so much, coming here, you should really bring enough
it's
spices.
not a big deal. It's pretty
Yeah.
cheap. So, Jibran, please, an ambassador of De Montfort University, why should students come to De Montfort University? We've
I mean,
heard magic.
I think of some of the things Magic mentioned, definitely I would agree with the multinational diverse community we have here makes it so easy for international students to integrate and just get along. So it's really a fantastic sense of community we have here. I mean, from a DMU perspective, the student support and what we have on offer here for the students is second to none for them. So I'm just going to run through a couple of things that we have in place for students who do study here. So we've got bespoke employability days set up, so students can go and visit and seek support for employability. We've got bespoke days for academic booster sessions. So if they feel they're lagging in particular areas, they can attend some of these academic booster sessions. I know the Global Health team runs monthly sort of catch-up sessions
Oh,
where
brilliant.
students could just go in. It's like an open surgery. Students can go in and just get some help with some additional issues and things like that if they're not too sure, they need some extra help or guidance. The Global Health team, in and of themselves, the teaching academic team, they're renowned for their research active staff members within the department. You've got researchers who are in the One Health area, in the Global Health area. You've got researchers who are looking at COVID global health implications and things like that. So they're very active in research and in very current in research. So if students are coming for looking at research in specific areas, not to mention mental health, because of course that links into our psychological health and psychological well-being courses as well. You've got researchers active in that field as well. Furthermore, we're currently in the process of applying for accreditation with the CMI. So that's the Chartered Management Institute. So this is hopefully going to allow some of our future graduates of global health to have chartered recognition as managers. So when they're going into these career paths of health promoters and community outreach, they can aspire to be managers in these areas as well. So this is still under process, so it's still under application, but hopefully we'll be getting some positive news with that going forward. And the last thing that's kind of underway is the dissertation modules that students take. Normally it's like 100% dissertation thesis finished.
Right.
Now we're planning to split that, so it's part dissertation and part oral poster presentation, just so it allows students a larger breadth of skills and demonstratable skills when it comes to showing off their research, basically, not only written work, but oral work as well. So these are some of the advantages of coming to DMU and being a student at DMU, the amount of support we have and the amount of academic excellence we have in terms of researchers within their own specific fields.
Brilliant. Okay, brilliant. So it sounds like, ladies and gentlemen, as you can see, Montfort University are actually working towards getting accreditation for their course. So your course will be recognized by the time you graduate. It will be recognized by other bodies when you graduate. Brilliant. Right, I don't know where the background noise is coming from, so I'll mute myself. Magic, would you kindly tell me, is there any pearls of wisdom? Jibran, could you mute? I'll mute myself in a bit. Magic, would you be so kind and tell us any pearls of wisdom or advice you'd like to give to students who are watching this right now?
Any advice? I would say, first of all, coming here, it's going to be so good because you are going to meet so many friends, and everyone is accessible, everyone is free and accommodating. That's about the place, about the cultural sensitivity around here. So, secondly, about the course is pretty intense. I would say that. Yeah, it's pretty intense, but at the same time, you should also know that you come here to study. So, but what the school really does is they consider everything you say. You have like a personal tutor, you have people you can talk to. If you feel you stuffed so much, they have people that you could talk to around the school. So maybe if you're feeling like stuffed, choked, you can just take a break from everything. And that's the thing. Secondly, about the course. And another advice I would like to give is just if you like spices, just bring a lot of spices because you're not gonna get any food. The food here in UK is so bland. It's really bland.
Okay, that's a challenge. Okay, right, Magic is saying that West African food is very spicy. You need to bring your
Yeah,
spices.
yeah.
What spices are we talking about? Which spices?
I'm going to say
You like
like
chili spices, but what spice are you talking about from West
like
Africa?
pepper chili stuff like that. Yeah, that's really really hot. So yeah, because I love pepper chili a lot. So you're
Oh,
not going to find that in common.
no, in Leicester. Oh, right. Interesting. Well, thank you so much. That's
Yeah,
pearls of wisdom. As you can see, Magic is being honest. This is not being edited or filtered anyway. It is intense. We're not going to sugarcoat it. So be
yeah,
prepared for that. So
yeah, sure,
we
sure.
have warned you guys. Be prepared. Right, Jibran, any pearls of wisdom from yourself? Anybody's watching right now or after the live, what advice would you give them about studying pre-masters leading to masters?
Um, I think some of the things Magic's mentioned is, coming to DMUIC as an IIM, one of the benefits students will get is they're taught in small groups. So there's that sense of a community within your group. You can see each individual student individually. You can speak to them, you can get to know them, you can find out what their problems are. And the fact that their tutors are just literally around the corner in the office, you can go to them for support, for advice, for help. And the staff here are very, very welcoming. So for any students who are kind of a bit nervous about coming to a new country and I'm going to find it difficult. The DMUIC and the IAM Health Science provides that sort of bridge into the masters where we support them gradually to get them prepped. So my advice is if you're worried about falling behind your studies, that's probably going to be the least of your worries because the amount of support and time we dedicate to you and to make you as successful as possible is going to be second to none. I encourage them. My office is at 211. Come and see me anytime you need. Right, just come and knock. Doors open. It's open door policy. If you
Yeah,
need help, come and speak to me. I never turn a student away if they come and ask for help. So really, it's these ways we try to support them. And once they're here and they become integrated with the community, with the students, there's immense opportunities for them to explore, whether it's societies or volunteering or helping out and just joining general groups amongst their friends. It just becomes very, very natural to them. So I think for me, the biggest advice is going to be, look, I know it sounds daunting at times, but you will be well looked after here as a student in your academic
yeah,
and even in your pastoral needs if required, because we've got a fantastic welfare team that look after students who are struggling.
yeah, definitely.
And
Brilliant.
Magic would agree. So it's the students saying that, not me.
Well, as you can see, Jibran has publicly said his room number. So, students, if you're watching this, he said open door policy to use that. No, it's very reassuring that you talk about your workshops, your drop-in sessions. Is that weekly or monthly, Jibran?
The global health workshops, they
Yeah,
are monthly. So Magic will probably confirm this for me. They have monthly
yeah,
global health workshops in the
monthly.
MSc.
Good.
The
That's good.
IIM ones,
Yeah.
We don't have them fixed into the calendar simply because my policy is kind of open door. So if a student
Right.
turned up, Monday morning at 9 o'clock, sorry, and is there, I'll say, yep, great, come in, have a seat, how can I help?
Brilliant, brilliant. Oh, right, he's lagging, but we did hear everything he said. Well, I just want to say thank you so much. I don't know, guys, if you get this vibe, but look at that smiley face magic. My goodness. That explains everything. It just shows how happy he was doing the pre-masters. Alhamdulillah, he's a successful guy. He passed with flying colors, and that's why Jibran has chosen him to come on board as an ambassador for the course. As you can see, Jibran, very supportive team, ladies and gentlemen. They are there, open door policy. Where would you get that in other UK universities? They're here to tell you that they're here to help you to succeed. Thank you, gentlemen. Thank you so much for your time. It's nearly Christmas, so I wish you all the best for your holidays. And guys, if you want an admission for this pre-master into global health, DM me direct. Until next time, my friends, take care.
All right. Bye.
Thanks,
Bye.
Afsana. Bye-bye.
Bye.
Bye-bye.